afternoon, everybody, and welcome to Care Connection. I'm so excited that all of you took time out of your busy schedule to join us today for our webinar presentation. And so today we have a very special guest. Her name is Rachel Herman, and she's a founder and executive director of Pets Are Wonderful Support, Paws NY. Rachel worked in development at the American Society for the Prevention of Cruelty to Animals, ASPCA, for several years before transitioning to Paws NY full-time in January 2012. As founder of Paws NY, Ms. Herman brings her vision to the organization as well as her passion for protecting the welfare of both animals and people. And today we will be exploring the bond between humans and animals. However, before we start, I want to go over some housekeeping. Everyone on the line today will be in listen-only mode. So what that means is that the questions will not be via the phone. Rather, on the right-hand side, you could type in your questions. And at the end of the presentation, Rachel will be happy to answer them. In addition, on the right-hand side, we have handouts as PDFs. So Rachel's PowerPoint presentation and some other information through our foundation, AFA, will be on the right-hand side for you to print or save as you wish. And so also one last thing is that our presentation will be recorded. So if anyone wants to visit this at a later time or share with colleagues or friends, it will be on our AFA website. So right now, I want to hand this presentation over to Rachel. And so Rachel, now could you please begin your wonderful presentation? Thank you.
Yeah, hi everybody. Thank you so much for having me, and thank you to everyone who's dialed in to listen. I'm really excited to share what I know about the human-animal bond with all of you, and I hope that you guys have some questions because I always feel like the questions lead to the most interesting part of most presentations. So before I kind of get into the bulk of everything, I thought that I would just tell you guys a little bit more about myself and my organization, just so you get a sense of the background on my connection to the human-animal bond, and then I'll kind of dive right in and get into some of the more substantive aspects. But as my introduction kind of described, I've been working in animal welfare for quite a while. I founded a nonprofit called Pets Are Wonderful Support. We go by the acronym Paws NY. And our goal is to keep people and pets together because we know just how beneficial that relationship can be, especially for some of our more vulnerable neighbors and family members who are dealing with health issues, advancing age, financial issues, and so keeping those pets in their homes is really, really important and important to both their physical and their mental well-being. And so I did some research. I couldn't identify organizations in New York City that were providing ongoing help to members of the community who are facing struggles, and so I decided to start an organization, and we've been growing every year, helping to keep people and pets together. And as you can see on the front page of this presentation, that's one of our clients and her cat, and it's just one of the many pairs that we've been able to help through the generosity of our wonderful volunteers. So that's a little bit sort of about how I got started and our organization, and I can answer questions about that later on and hopefully give some more detail. But let's get started. So let's see, the presentation is not clicking. There we go. So, and just to note, all the pictures you see in this presentation are of current clients and their pets that we're helping. And so what I'm going to do today is talk about the human-animal bond and also animal-assisted interventions, and then give you guys some ideas for what resources are out there to help bring these interventions into the lives of the people that you know, whether they're your family members or clients that you're working with professionally. So hopefully this is really helpful for you guys. So for those of you that don't know, the human-animal bond is a mutually beneficial relationship between people and animals that has a positive impact on the well-being of both the human and the animal. You think about the human-animal bond, you see this wonderful picture of this woman and her cat, and you can just see the joy on her face and all the happiness and love that she feels because of that relationship she shares with her cat. And that relationship is just so important. And moving on from there, there are lots of different ways that animals and humans can interact with one another to the benefit of both the human and the animal. And we call those animal-assisted interventions, AAI. And AAI is a broad term, and it's used to describe the utilization of animals in ways that are beneficial to humans. And there are a few different subcategorizations of animal-assisted interventions that I'll walk through for you. There's AAT, which is animal-assisted therapy. There's AAE, which is animal-assisted education. And there's AAA, which is animal-assisted activities. And I know I'm throwing all these acronyms at you. It's very confusing. I don't expect anyone to remember the differences between all of these, but just helpful to give you a sense. They are their own sort of unique categories. So animal-assisted therapy refers to using an animal in psychotherapy, occupational therapy, and these are therapies that are administered by professional health and human service providers. So this is a really formal kind of animal-assisted intervention. There's also animal-assisted education, as I said. Those are things like reading programs, humane education. Sorry, let me just go to the next slide here. Reading programs, humane education, and these are administered by education professionals. So, things like I actually recently read an article about school children who are going into shelters and reading to the shelter animals, and it's a way to help the kids become more comfortable learning how to read, because maybe they might be embarrassed reading in front of their parents or other students or their teacher, and it's a way to get them more comfortable. And I feel like this is actually like a really unique way of incorporating the human-animal bond, and I thought it was a really lovely idea and something I'd love to see more of. And then finally, there's animal-assisted activities, and these are activities that enhance the quality of life, hospital visits, stress reduction, animal-assisted crisis response. And these are usually administered by volunteers. So, you're thinking about therapy animals that are going into hospitals to help positively impact the residents or the patients in hospitals or, assisted living facilities, things like that. And these aren't, it's different. It's not administered by an education or a health professional as the former two that I discussed. This is a little bit more informal and is a really great way to help bring joy and happiness and health benefits to people who need it. And again, just if anyone has any questions, please submit them. I'm not used to this webinar format where it's, questions are held to the end. I tend to like having the interaction, but I realize it can also be derail a conversation. So I am hoping for some good conversation toward the end. So the next thing I wanted to talk about is the different animal classifications that fall kind of within this animal-assisted intervention area. So there are service animals, emotional support animals, therapy animals, and companion animals. And I'll walk you through the difference between each of these terms. And again, I feel like it's really easy to confuse all of these. And so, it's a lot of different information, and I think people often use some of these terms interchangeably. And so I'm just going to kind of go through what the differences are for you guys. So a service animal is, and sometimes known as an assistance animal. They're animals that are individually trained for people with disabilities, and these disabilities can be both physical or mental. The animal is trained specifically for one person, and it must relate directly to that person's disability. The animal must do work or perform tasks for that person. So, an example of that is a guide dog, right? Somebody who's blind or visually impaired that has a guide dog, that's a service animal. That's a working animal who's performing tasks to help that individual who's facing this particular disability. The service animals are legally allowed to accompany people with a disability in public places like restaurants and other businesses. So this is the only animal of the 4 classifications that I'm going to go through that does have that sort of authority to be in places like restaurants. The other categorizations, it's not the same kind of flexibility. Another example of a service animal, which I think is a really incredible thing, is, I don't know if you guys have ever heard, there are animals that, dogs, that are trained to work with individuals with epilepsy, and they can actually sense when seizures are about to happen. And so for people with epilepsy who have this service animal, and you can actually, if you Google this, you can find some incredible videos online of, animals who are paired with somebody with epilepsy. And what they do is they can sense when it's about to happen, so they kind of indicate to that person that, so they know it's about to happen, and that person can get to a safe place, whether it's lying on their couch or on their bed. And the animal is there to comfort them and ease them and help them get through that really difficult situation. It's really incredible. And there's lots of other ways that animals can be service animals, but those are two examples. Moving on from service animal, there are also emotional support animals. And emotional support animals are pets that provide therapeutic support for an individual with a disability. And it has to be a disability that significantly impairs one or more major life activities, and that the animal is necessary to maintain the person's health. So in order for an animal to be deemed an emotional support animal, a mental health professional or a physician has to essentially write a letter indicating that that pet is critical to that person's well-being. And so what that does is, whereas a service animal is trained for an individual, an emotional support animal is more often like somebody's pet. So it's not such a formal designation. But if your mental health provider can attest to the fact that this animal is providing you with such important therapeutic support to deal with your disability, then you're covered by the Fair Housing Act. And so that means in places where, the landlord says no pets allowed, you can actually have pets if the pet is deemed an emotional support animal by the person's physician. So that's a really interesting distinction. And then moving on from emotional support animals are therapy animals. And a therapy animal is a pet that provides therapeutic support to many individuals. And this animal is trained with a handler to work with people. They do not have specific rights of access like the service animals or the emotional support animals in housing. And their usage varies depending on structured goals. So an example of a therapy animal is basically, somebody who has a pet, they can go through training with their animal to be a therapy animal, and then they can do things like visit hospitals with their pet. And they're really done as a team. It's not the pet on his or her own, but it's the team of the animal and the person doing this together as sort of a volunteer opportunity. So sometimes you'll have pairs of people who are visiting hospitals or nursing homes, and that when you see that, that's a therapy animal team. That's not an emotional support animal. That's not a service animal. So, and again, no special rights of access, and that's because that pet is not a service animal or emotional support animal for their guardian, right? It's just a decision the guardian has made that they want the benefits of that pet's love and positive attributes to benefit other people who could really benefit from that relationship. So it's a really cool thing to see people who have pets who want to then share that love of their pet with other people who really need it. And then finally, we have the last classification is companion animals. And this is just our pets, right? Our dogs, our cats, our hamsters, our rabbits, whatever pet it is that we have. There are no specific therapeutic purposes in the way that I've discussed these three prior categorizations. But as we all know, and as the whole reason I started my nonprofit is because companion animals really do have a strong positive impact on a person's well-being, both physically and emotionally. Companion animals don't have special rights of access, just like therapy animals don't. They're just our pets, our companions, our best friends that we get to wake up to every morning and spend our time with. So that is those are the classifications. And then moving on to the benefits of the human-animal bond, there are both physiological benefits, and there's also the mental and emotional. And there is a lot of crossover in terms of these benefits. A lot of the physiological benefits result in some of the mental and emotional, and I'll walk you through some of these. So in terms of the physiological benefits of the human-animal bond, individuals who have the ability to spend time with pets experience an increased awareness of their environment. They will see a lower blood pressure and heart rate. There's a reduction in risk of cardiovascular disease. There's lower cortisol levels. And cortisol is, just so everyone knows, it's a steroid hormone released in response to stress. There's also an increased production of oxytocin, and oxytocin is what makes us feel happy and feel good. And being around pets means that we are going to have more of that oxytocin, and we're going to feel better, which is going to impact so many different facets of our lives. And then finally on my list, because I'm sure there are tons of other benefits, increased flexibility and fine motor skills. Taking care of an animal and doing all of the things that we need to do to provide for them can be a benefit as well. So moving on from the physiological, there's also the mental and emotional. Increased social interaction. This is, really huge for people who have dogs, who are going outside to walk their dogs. We have many clients. Our clients have a lot of limitations in terms of their mobility, and it's hard for them to come to us and ask for help. And sometimes some of our clients are able to get outside for short walks with their pets every once in a while, and it's really good for them. It's good for anyone who has a pet. There's this sort of community that I've found of pet lovers, especially if you have a dog and you're going outside. People know your dog. People in the neighborhood know who that dog is, and it's an opportunity for that person to meet new people and to socialize, and it becomes like a really important part of somebody's life and can get them up and out of the door, which is really important. There's also a reduction of depressive symptoms. And this, I think, as I said, the connection, I think we can relate this back to the increased oxytocin, right? Feelings of happiness and comfort. Improved mood. Decreased feelings of isolation and loneliness. Again, this is the whole idea of, there's kind of a couple of components to this, right? There's getting outside and meeting people in the community. People see your pet and they talk to you, and you get to meet more people. But in addition to that, you've got your pet at home. So even if you don't have a dog, you have a cat, you have a bunny, you have a snake, whatever your pet might be, that pet is providing you with companionship and a sense of purpose, which is the last thing on my list. And that's really, really critical. You know, for the clients that we help, you know, most of our clients are homebound elderly individuals, and being able to decrease feelings of isolation and loneliness is so critical to their health and their well-being. And it's such that their ability to have a pet is just so important. And we're really happy to play a role in helping them remain together. And I'm really happy to be speaking today to hopefully educate, you know, everybody. For those of you who sort of were less knowledgeable about the impact of the human-animal bond or a little skeptical, like, I'm hoping that some of you feel more confident in the benefits of the people that you know maybe having connection with an animal in some kind of way. And you know, increased social interaction is really great for our clients. There's a really cool piece to this because we're sending volunteers into our clients' homes as well to provide pet care. So in addition to our clients being able to remain together with their pets, they're getting relationships with volunteers who they're seeing every day, and it's really cool to see the kinds of bonds that have been established. So that social interaction is a really cool piece to this. And then higher levels of empathy is another emotional benefit of the human-animal bond. Decreased aggression, increased self-esteem, and increased sense of purpose. And as I said before, I think a lot of these emotional and mental benefits are directly resulting from the physiological, right? The lower cortisol levels and the increased oxytocin are leading to all of these really positive results for anybody with a pet, but in particular, you know, the people in our community who are dealing with health issues, for people with Alzheimer's, people with cancer or other illnesses. These benefits, I think, are that much more powerful. So then with all of this, you know, I wanted to kind of walk you guys through what some of the resources out there are that are available. And I just want to keep in mind, I'm based in New York City, so I am much more familiar with what's going on locally here. And so I want to just sort of make the caveat that services around the country and in New York are constantly changing. So what I'm going to go through is no way an exhaustive list of resources. They're the resources that I'm familiar with and that I've come across in my research. But things are constantly changing. New programs are being added. Some programs are going away. And so I just wanted to be transparent about the fact that this list of resources I'm going to go through could change. So when a pet and guardian pair needs help physically, so I'm going to go through the New York resources first and then talk about outside of New York. So first on the list is my organization, Pets Are Wonderful Support. And as I mentioned, our goal is to help people and pets stay together. And we focus on helping individuals in our city who are most at risk of losing their pets. So these are people with both physical obstacles who are also low income. So they're unable to provide for the physical needs of their pet, but they also don't have the financial resources to hire somebody. We provide our services throughout the 5 boroughs of New York City, and our main program is our house call program, and that's where trained volunteers go into our client's home and provide help with physical pet care, dog walking, litter box maintenance, light grooming, putting out food and water, vet transport, the sort of like basic day-to-day stuff that for many of us are simple to provide, but for the clients that we serve are really difficult and could mean that they have to give up their pet if they don't have any assistance. And then once accepted into our house call program, our clients have access to some additional supplemental services. We provide free vet care thanks to some grant funding and partner vets. If a client's hospitalized, we can provide emergency and foster care for their pet. What we found is that many of our clients will not agree to seeking medical care if there's no one to take care of our animal, which is really scary. You know, pets are so important to people, but at the same time, we don't want, I'm sorry, there's a motorcycle driving by and it was loud. At the same time, we don't want people making sacrifices that could have a negative impact on their health and well-being. So we come in, we make sure our clients know that we will be there. They don't have to worry about their pet. And then when it's time for them to go home, we reunite them. And that's been an incredible help to our clients. And then we also provide pet food to our clients when we have it, and that's actually a program we're really trying to grow this year so we can be a more consistent source of support. So that's our program, and just to give you a sense of our scope, last year we helped about 250 people and their 400 pets, and we have about 1,200 trained volunteers. And we are a really small organization in terms of our staff and our budget size, but we're able to do so much because of the incredible commitment of our wonderful volunteers. So moving on to other New York City resources, there's an organization called Search and Care, which is a social service organization with a program called Pets and Elders Together. They offer services very similar to Paws. The main difference is that they have stricter catchment guidelines. So they only serve senior citizens who reside between East 86th Street and East 138th Street in Manhattan. And the main difference for us is we serve anybody with the physical and the financial obstacles. So while most of our clients are seniors, we do have some younger clients who are dealing with illnesses or disabilities, and as long as they also meet the financial piece to our qualification process, we would be able to provide them services. So that's kind of the difference. We're a little bit broader in terms of our approach, and Search and Care is a very specific organization serving a specific population, so that's what they focus on. So that's another group doing this work in the city as well. The picture here is of one of our clients and his dog Jade, and Jade is such a sweetheart. Jade likes to dance for Cheerios, and this, just a little tidbit about them, this client has been with us since basically I started the organization back in 2010, and he still has the same group of volunteers. He's developed really amazing relationships with them, and Jade is getting walks all the time and medical care and is on medication, and it's really amazing that we've been able to help keep them together because Jade is Arnold's lifeline. They are just such a wonderful pair, and I know that having Jade means everything to him. So outside of New York City, there are some other programs that we've come across. There's an organization in San Francisco, the Marin County Humane Society, provides ongoing support for low-income seniors. Not listed here, actually, and I apologize for that. There was an organization out in San Francisco with the same name as us, Paws, that recently merged with an organization called the Shanty Project, and they provide very similar service to us, and they've been around since the mid-'80s, and they do provide support to seniors and people facing difficulties caring for their pets. Chicago, temporary assistance for guardians facing crises that prevent them from caring for their pets. And I provide links. I don't think I need to list every single one of these, but you can kind of see the list. And as I mentioned earlier, I don't think that this list is by any means exhaustive. It's honestly a bit challenging to pull together every single organization that exists out there. And as I was preparing for this presentation, I really thought that perhaps we should put something up on our website that compiles all of this information because it is constantly changing. This is the human-animal bond field is, the idea of the benefit of animals has been around for a while, but I think only in recent years has there really become a greater appreciation for organizations that are doing this kind of work. And so I don't know, maybe this will be a project I take on after this so that way people all around the country can more easily find the resources they need for where they live. So this lists Chicago, San Francisco, and DC. And then that was all sort of for the physical assistance, but now what about people who need help financially? In New York City, there's Animal Medical Center. They have a SAVE program, which is for senior citizens. So if any of you live in New York and you have a family member who's a senior, or you're working with somebody who's a senior, you can reach out to Animal Medical Center. There's an application process. But once the person is accepted in the program, I think it's something like $4,000 a year. It's a lot of money that they designate. Don't quote me on the exact amount, but it's a high number that they provide to the seniors in their programs, and it's free medical care for their pets, and it's amazing. Animal Medical Center is also really great. They provide all the veterinary care for seeing eye dogs in the city as well, free veterinary care. The Humane Society of New York is a really good option for low-cost veterinary care as well. So is the ASPCA for emergencies. And then there is a low-cost mobile veterinary van as well that goes around New York City. So then outside of New York City as well, and again, it's a list that's probably not exhausted. I'm sure there are other wonderful programs around the country that are providing assistance. The few that I've put together for the presentation, there's one in Atlanta, Paws Atlanta, that provides vet care, transport, and education for senior and disabled guardians. And then in San Diego, pet food for senior and disabled guardians at Animal Center. And then what I've also included is a list from the ASPCA of safety net programs that they've funded, and that can be found on their website. So again, it's not exhaustive. It's constantly changing, which can make this confusing, but there are a lot of really wonderful resources out there for those of you who are, you know, if you have a family member or you're working with somebody who has a pet as a companion and who needs a little extra help physically or financially. So we've also got LA, Florida. Let me minimize this. Just lots of really great organizations out there. Organizations providing pet food, veterinary care. So the next thing I wanted to talk about is pet therapy home visits. This is, and as a reminder, therapy is, when we talk about pet therapy and therapy animals, we're talking about not service animals, not emotional support animals, but teams. A team is defined as a human and their pet who are trained to visit with people. Now, there's a lot of pet therapy teams that work through organizations that visit institutions like hospitals and nursing homes. There aren't as many out there who do home visits, like into an individual's home if it's not a part of like a larger institution. So what I've done here is I've listed the two that we're familiar with that do send pet therapy teams into individual homes, which I think could be a really good option for some of the people that you guys might have in mind. So there's Therapy Dogs International. With a referral from a physician, TDI sends trained pet therapy teams to a patient's home. And this is a program that's offered nationwide. And I put a link there so you guys can easily find it. And there's also Pet Help Partners. Must be coordinated by a hospital or healthcare agency initially, and they'll send a trained pet therapy team to a client's home as well. And again, this is also national. And I love this picture, by the way, of this client and her cat. I think it's, I don't know, I just think it's really beautiful. So that somewhat covers, you know, all the material that I've formally prepared. I have a list of the reading, the citations, so you guys have access to that. So now I'd love to open it up to any questions that you guys have, and you know, hopefully we can kind of keep the conversation going for a little bit. And again, I just want to thank all of you for listening and for having me, and I hope this was helpful.
So thank you, Rachel. I do want to remind everybody that on the right-hand side, you have the opportunity to type in questions. And we do have a question for you, Rachel. We have someone, Chelsea, who lives in Eugene, Oregon, and she would like to know, do you provide support for older adults who need to stay in the hospital for a few days to a few weeks and need someone to care for the animal while they are away from home? So are you familiar with anything in Eugene, Oregon for this need, or to refer Chelsea to somewhere in Eugene, Oregon?
So that's a good question. Totally honest, off the top of my head, I don't. But what I'd like to say is my email address is up on the screen. Please email me, because what I'm going to do is I'm going to take notes, and for anything that I can't give an answer to directly on the phone, I'm going to go back, figure it out, and I can, if you email me, I'll be able to respond and get you that information. So the short answer is no, I'm not aware of anything right now, but that doesn't mean that something like that doesn't exist. Programs like that, I will say, programs like that do exist. Some of them have existed in the city, here in New York City, and they don't really anymore. You know, because they're somewhat complicated to. It's actually not funny is not the right word. The timing is interesting that question is asked, because I myself had a meeting with somebody just yesterday to talk about adding that as a service that we provide here in New York. We get a lot of calls from hospital social workers for people who are in the hospital and have a pet at home. And right now it's really difficult for us to respond, because we have a pretty, I don't know if rigorous is the right word, but in-depth approval process. And part of that process is seeing the home and making sure it's a safe place for volunteers before we send them in and agree to services. So it can be a little complicated, but it's something that I know for us, like, we really want to be able to provide, and we're trying to figure out how to make it work. So it certainly could exist out in Eugene, and I'll definitely do some research and see if I can come up with anything for you.
All right, thank you, Rachel. And again, Chelsea, you could email Rachel. Her email is up there at rachel.herman@pawsnewyork.org, and she will be happy to look into this for you. Now, we do have another question from Valeria. Her question is, what's the referral process and time frame for your services?
So, great question. So in terms of the referral process, we try and work as quickly as we can. The way it works is clients come to us through two different ways. Either a client is contacting us directly because they heard about our services, or more often than not, we're getting a call from a case manager on behalf of their client. And they'll say something like, I have a client who needs your help. I talked to them. I'd like to get them enrolled in your program. From there, there's a two-step process. Step one is a phone intake, where we speak with the client. And our services, by the way, we're not forcing our services on anybody. So every once in a while, a case manager might refer somebody, and when we talk to them, it turns out that they would rather not have our help, which is totally fine. So as long as the person is open to having volunteers come in and help them, we do a phone intake first, where we get some basic information, their contact information, and then we determine if they qualify and they meet the physical and financial piece. So in order to qualify, they have to have a physical impairment. It might be a disability, an illness, a mental illness counts as well. You know, anything that's preventing them from providing for the physical needs of their care of their pet. And then financially, we have an income cap, and that is $1,850 a month. So if the client is at or below that cap and has the physical piece, then we know that they qualify. And then step two is we do an in-home intake. Our program director, Carrie Neidick, will go to their home, fill out some paperwork. That's an opportunity for her to, as I said before, make sure the home is a safe place for our volunteers. Like, we're here to help our clients and their pets stay together, but at the same time, we also do have a responsibility to our volunteers to make sure that they're safe and we're not sending them into a home that they could be put in danger. And so it's a bit of a home assessment for us as well. Although, to be perfectly honest, there have in the 5 or 6 years we've been providing services, it's like maybe once we've seen a home where we said like we didn't feel comfortable with a volunteer. It rarely happens. And then from there, we come back, we find out their needs, and we reach out to our volunteers. Usually, for example, if somebody has a dog, they need more help, more visits than somebody with a cat. So say they need 2 visits a day, 14 visits a week. We'll usually be able to get volunteers in pretty quickly, but we have to work our way up to a full schedule. So we might be able to get 2 or 3 people in right away, and then over time we'll continue adding people. So it's not like snap our fingers and we've got all the shifts covered. It's really working hard to fill in all of those gaps. So it varies. It depends on the neighborhood. Some neighborhoods are easier to find volunteers in than others. Some pets are easier. The breed, unfortunately, sometimes can impact the size of the animal, the time the walk is needed, things like that. So there's a lot of things that go into it, but usually from the time a client's referred, we're meeting with them within that week, and then usually we're getting a volunteer to them, within the week after that. So it's relatively quick, but it can take time depending on the situation. That was very long-winded. I apologize.
That was really great, Rachel. We actually do just have a question from Vanessa. And could you just please repeat the financial income limit for your program?
Yeah, absolutely. It's $1,850 a month. So, a client would have to fall below that number to qualify.
Thank you so much. And we have another great question from Rita. Her question is, many homeless people have pets. Is there any outreach to that population if you are aware of?
Sorry, say that again. There are many people. I missed the beginning.
There are many homeless people who have pets. Is there any outreach to that population that you're aware of?
Yeah, that's actually a great question. And I didn't mention this, but it was actually a homeless couple and their pet that was the catalyst for me starting Paws. When I was in grad school, there was a homeless couple that I would always see outside of a grocery store, and it broke my heart because homeless shelters don't allow pets. And so I realized that this couple was giving up a warm bed at night because of the strong relationship they had with their pet. So that I went home, I started thinking about all the people in the city who have animals and benefit from them, which led me to seniors and and so that's why I started this organization. There are groups in New York City. There was one called Collide, which actually I believe might not exist anymore. And this is why I said earlier, I've said it a couple of times, the list is never exhaustive because there's just so much movement and change that's happening in this field. It's pretty hard to kind of get started, and once you do, maintaining the organization and growing it and sustaining it is challenging. Collide was an organization created here in New York City that was focused on helping like sort of the younger homeless population in New York City with their pets, and they would help with vaccinations and pet food and things like that. They weren't providing the kind of assistance that we do, because what we do is like walks and things like that, which is not really, it's not the same kind of need. But that's a good question. I'm going to do some more research into that. There was a site that I'm aware of, I think it's called Pets of the Homeless, which may be a resource for programs like that. But you know what, if you email me, I'm going to just go back to if you email me, so I have your contact information, I'll look into this as well and send you any resources that I come up with.
Perfect. Thank you so much, Rachel, for being so available. We do have another question. We have, these questions are all so great. We have one from Joyce Vanderpool, and her question is, we have a therapy team that helps with grief therapy, particularly with children in the in the loss of a loved one. How common is this?
So how common is that? I think it's common. You know, providing, and I will say, like, it's not something that we provide through Paws, so I'm not like directly familiar with that kind of work, but I do know that just in general, the positive impact that pets can have on children is really powerful, and to hear about a program like that, I think, is really great. I don't think there's tons of them, but I do think that programs like that exist nationwide, and you can probably find in most cities at the very least. Our program director, Carrie, actually was involved with an organization here in New York City called Gallup, which is an organization that uses horses. It connects horses, I believe, with children with autism. I could be wrong with what their mission is, but it's children with disabilities. I know that's different than bereavement, but it's just the same kind of idea in that it's providing support and help to kids, which I think is really great. And I think with kids in particular, sometimes they can't really express how they're feeling or don't really have like a proper outlet for it. Similar to how I mentioned that program earlier about the kids learning to read and they were reading to the shelter animals. And I think, having a relationship with a pet can be a really powerful way for kids to deal with something as terrible as losing a loved one, and something as not so terrible, but learning to read, right? So it kind of can span a lot of different things. But I think those programs are really great.
Okay, and Joyce just had clarification. I thank you, Joyce, for that. And she was referring to a licensed counselor with her therapy dog, which we know is common. So Joyce, thank you for bringing up that. Thank you so much. Now, we do have another question from Vanessa. I understand your program services the 5 boroughs of New York City. Do you know the turnaround time for allocating volunteers in Staten Island?
Yes. Well, we do not have a huge presence in Staten Island, and it's actually something that I've been trying to work on. If anybody knows anyone out there, Staten Island is tricky because it's not as easy to get to, public transportation, and we have a really small staff. So we do have a couple of clients in Staten Island, but it's certainly not where it needs to be in terms of our services. So I've been actually racking my brain to try and figure out if there's an organization out there that would want to partner with us on a pilot program. An organization out there that might be able to help connect us to both people in need of our services, but also might be able to help connect us to the community to help us figure out how to recruit volunteers. And then try and get some funding for that, because it's a little challenging for us to do now with our limited human resources. But I think if we can get some dedicated support and some community partners, that could be something that could really take off, and I know it's really needed. So that's my way of saying we're really not doing great stuff in Staten Island right now, because of it's so close yet so far for those of you who live in New York, so we kind of have to figure out how to overcome some of those obstacles.
Great. And so while we're waiting for other questions to come in, I do want to go over some of our services here at the Alzheimer's Foundation of America and some upcoming programs that we will be hosting. Some exciting news. For those who missed the webinar for January, we will be having an encore presentation, and that topic is planning and preparing for early stages of Alzheimer's. And that will be on March 15th from 1 to 2 p.m. Eastern Time. In addition, we do have a special edition Care Connection webinar on health literacy, which will be taking place on March 23rd, again from 1 to 2 p.m. Eastern Time. And for all of you New York State social workers who log on, you guys could get 1 free CE, continuing education credit. Now, in addition, I do want to let you know, April 13th will be another Care Connection webinar, and that will be on the topic of review changes associated with the stages of Alzheimer's disease. In addition, Alzheimer's Foundation of America is celebrating our 15th year, and so we're traveling across the United States educating America. So our next pit stop will be on March 27th at West Palm Beach at the Hilton West Palm Beach Hotel. So if anyone's in that area, it's free, and we encourage you, your coworkers, family, clients, all to attend. It will be a great educational opportunity. And we have one in May, which will be in the New York area at the New York Hilton Midtown, and that will be May 5th. So again, it will be May 5th, and we encourage anyone who's interested to come join. And if you have further questions, you could give us a call on our helpline at 866-232-8484 or visit our website at www.alzsdn.org. And while we're still waiting, if anyone has other questions, talking about our helpline, our national toll-free helpline is available Monday to Friday, 9 a.m. to 9 p.m. Eastern Time, and on Saturdays from 9 a.m. to 1 p.m. Eastern Time at 866-232-8484. Also, we have our Dementia Care Professional of America, our DCPA program, where here at the Foundation we have the opportunity to educate. We have our training DVD, which it is Social Workers Month. So I want to let everyone know that for Social Work Month, which is all of March, our social workers could get a discount on our DVD, and that will be at a cost of $150. So if anyone wants to purchase our DVD who is a licensed social worker or a social worker, call our helpline, and we would be happy to place that order. And we do thank all of our social workers who dedicate all their time and energy helping those who need help. And so I see that there are not any other questions coming in. So I do want to thank everyone for joining our webinar presentation. I specifically want to thank Rachel. You did an amazing job. I certainly learned a tremendous amount. And I want to welcome everyone back to our next webinar and all great programs that we offer at AFA. So we thank you, and we hope everyone has a wonderful rest of the afternoon.
Yeah, thank you guys for having me. It's been really, really wonderful. And I just wanted to say, too, you know, again, for whether you asked the question and I said follow up with me, I'm always available to answer any questions. So happy to email back and forth with any of you if anything comes up in the future.
And I do want to say Cheryl did have such a nice comment. Thank you, Cheryl. She enjoys each one of our webinars, and she always gains a wealth of information, and she particularly loved your presentation today. So thank you, Cheryl, for joining us on our daily webinar program.
Thanks, Cheryl. So nice.
All right, everyone. Have a great rest of the day, and we look forward to our next presentation. Have a good one, everybody. Bye-bye.
Thanks, everyone. Have a good day.